Growing up, looking at the positive impact the physicians had on patients' life, I think that's what drew me to medicine. I had an injury myself. Like I had a forearm fracture growing up. I had Osgood Schlatter's in my knee, but that's not something that, hey, I gotta fix myself. It's something that when I looked at the patients, when they had better function, when their quality of life was better, that I was like, hey, this is really meaningful. And that's what drew me to orthopedics. As a specialist, I'm a hand and upper extremity surgeon with, I would say, additional expertise and an interest in complex trauma, fractures, brachial plexus, and nerve injuries. You have to attack it from all the tools you have in your box. So a lot of it can be splinting, rehab, occupational therapy, sometimes just modifying the activities. Like, for example, if somebody has arthritis in the fingers, just modifying the grip of your racket can actually give you a huge relief when you're playing sports. I think there are multiple instances every day that are very fulfilling. Whether it's a patient having a good night's sleep after having carpal tunnel release, to a patient who is using his arm or hand for the very first time after major injuries, and seeing those patients being able to use the hand again, being able to lift things with the hand, do fine activities with the hand. Patients with congenital deformities, saw a patient who had never used her thumb because of a congenital deformity, and even before surgery, just giving her a splint so that the thumb was more in a stable position. And she told me this was the first time she held a water bottle and she could open a water bottle. Seeing your patients do well just brings you a lot of joy and happiness.